What's up, Talk Nation? My name is Chanel, and today we have
I'm Courtney. You can call me Gigi.
Courtney Gigi. So you are a nurse for a living. So
Yeah.
how long has it took you to become a nurse? Like, how long was the program for?
So I've been kind of on like a rough journey. So I actually started off in RN school and then I didn't make it through. So I'm currently an LVN.
Oh, okay, you're an LVN.
Yeah, I'm an LVN. So the LVN program does take 1 year, but
Okay.
RN school can take anywhere from 2 years to 4 years, depending on what route you want to take. So yeah, to answer that question, I guess so. 2 years.
So, what exactly is a RN?
The RN, so it's a registered nurse. So they do like a wide variety of things depending on like where you want to work. You can do ICU, you can do med surge. You can do a variety of things, but like I'm a new nurse.
Okay.
Yeah. I've only had like a year of experience, and I'm an LVN. I work in a SNF.
Okay.
So you're working mostly with elderly population.
Okay.
Yeah.
And so what do? You like draw blood and pass out medication?
So the LVNs can draw blood. I do have my IV certification.
Okay.
But me, I don't have much experience with that.
Okay.
Just med pass, G2, tube feeding.
Tube feeding.
Yeah,
Okay.
tube feeding, stuff like that, and just like medications by mouth or PO meds.
Okay.
For like my nurse people. And I would just say that the population that I work with, they're mostly bedbound total care patients.
Okay.
And I'm just working on getting my experience.
So what inspired you to do this in the first place? Because it seems like you have to really care to be a part of that, because it seems like these people are just bedridden. They can't really do anything. So what inspired you?
Yeah, so actually I'm pretty much en route to becoming like a nurse, like I guess you could say like a women's health NP. I want to become a nurse practitioner.
Okay.
So yeah, I'm not really where I want to be.
So you want to work in the doctor's office?
You can say that, doctor's office.
Okay.
But I want to become a nurse practitioner. So that's more, that's like your more advanced practice nurse. So
Okay.
yeah, I'm gonna have to do more school for that.
Oh, okay.
Yeah, you could say that. Yeah. So
you really
health.
inspired in taking care of people.
Woman, or like more maternity. So this is what I'm gonna have to go through.
You want to be maternal?
Yeah.
So you want to do it with pregnant women?
Yeah, you could say that. Yeah, like pregnant women. I can do like not, because they don't really have such things
diagnosing with people with like STDs and things like that.
Okay, that could be a part of it. If they have STDs.
You want to do women's health?
Yeah, women's health, because they don't really have like obstetrician nurse practitioner, which I kind of had to like learn the hard way.
Okay.
But they do have like they have women's health, that they have that category there.
Okay.
But that's kind of what I want to do, work with mom and baby. So I'm just trying to get to that
okay.
point.
You want to work with mom
Yeah.
and baby. Okay.
Yeah,
You want to do the babies and the moms.
Yeah, stuff like that. So it
And
would have
like
to be
the checkups soon as they leave the hospital type of thing. Oh, I get it.
Yeah,
okay.
but I think it's just like women's health, like I would have to like, I think it's just like called that, but it wouldn't be called like OB, because like if I was to go to medical school, then I would be called like OB,
OBGYN.
Yeah, but then for like nurse practitioners, it's not necessarily called that, I heard.
Oh, okay.
Yeah.
Okay.
So but that's really what I want to do. I just want to be able to give back and stuff like that. So yeah.
You love giving back. What inspires you to
Yeah.
give back to people?
Me personally, like I don't really know if it has to do with the relationship I have with my mom, but honestly, I just kind of want to be there to support other women. And
I love women who support women.
Yeah, that's just
and be there for women, because that's
Yeah.
very important.
Yeah, that's just kind of what's inspiring me to do this. I mean, maybe in the future go into education. I'm still somewhere where I'm trying to figure it out, but I know I want to go into women's health.
Okay.
So yeah, that's just kind of the path that I'm on right now. It's gonna take a while because I'm at LVN, but I am looking into doing the RN this year.
Okay.
Yeah.
So you about to go to school soon?
Yeah, and it's like, man, it's like I'm not even taking a break because I just got out of LVN school, but I really don't want to take a break because it's going to take a while, you know?
Right.
So, yeah.
So what are some of the difficult patients you have dealt with so far?
So I would say the most difficult patients would be, I don't know, all of them? Yeah.
All of them?
Okay, but no.
Yeah, because you got to like feed them through a tube and things like that. So these are people you working with that like in ICU patients. Like
okay,
they can't
ICU, Okay, so there's ICU nurses. So the LVNs are not really working with the ICU patients. Those are more the RNs that are ICU nurses. You know, there's different types of RNs that do that.
But these people are bedridden and they do depend on you.
So my patient population.
Because you like taking them a bath. Do you do that?
So you know, like there's task delegation.
Okay, so tell us exactly what you do, because you said feeding through a tube and then.
Okay, so when I said tube feeding, so I was just trying to give a breakdown of what my job entails. So when I get there, you know, I can give patients medication by mouth, or like what's called PO meds, or you know, some of them have you know, like tube feeding. So maybe you have to crush their medications and then you need to put it through something called like a G tube. So that's what I mean, you know. So that doesn't necessarily mean they're a difficult patient. You know, some of them are talking, or some of them are not necessarily talking. You know, but I would say like your most difficult patient could be like your psych patients, those that have like the, you know, psychiatric condition. It can be schizophrenia or bipolar. Though we don't always have those at our facility. Usually they would be at their own facility, like the psychiatric facility.
So do you go to those facilities?
I do not. I don't work in a psychiatric facility. Okay. But as a part of your training in the nursing program, you do need to get training with those clients. Okay. Yeah. With LVN school, with my program, we didn't really have too much one-on-one with the psych clients, but in my RN program, I did, you know, so you get to kind of see firsthand what it's like dealing with those psych clients, and yeah.
So you basically work inside the home?
Okay, so with the psych rotation, no, so you're going to urgent cares.
Urgent cares,
so that's like they might come in and they stay in these
So you do work in like a hospital environment?
So where I work is something called a SNF facility, or skilled nursing facility.
Okay.
Yeah, but I'll just give you an example of like.
So is that like they live there?
Okay, the SNF facility, yes, they are gonna live there. So it's like a long-term care, but they can get discharged from a long-term care facility. They can go home. Okay. They can go home if the doctor gives the okay.
Okay, so they could go home like on weekends and stuff.
No, they cannot go home on weekends. They can go home if the doctor gives the okay. They have some facilities that are like assisted living as well.
Assisted living, okay.
Yeah, they're more kind of like apartments, but those are more like apartments where it seems more like
care. Like in-home care.
Yeah. No, not in-home care. That's something totally different, you know. But yeah. So yeah, I work at a SNF. It's a skilled nursing facility.
I'm gonna have to look that up. Look that up. Well, educate myself.
Yeah, you know, like okay, well, when our mom and dad gets older, we might get to that point where we put them in those facilities when we can't take care of them. Yeah, because
some of them have like dementia, Alzheimer's, things like that.
A lot of them have that.
Yeah. Or they can't remember everything. They can't remember to take medication. So you're like the type of person that comes in and making sure they take those medications.
Yeah. But some of them are honestly in there just for different stuff. Like some of them won't really be in there just for that. Like some of them are in there, you know, like maybe like
mental issues.
No, not for mental issues. Like it could be like, you know, for, I don't know, like they might need to stay in there for a few months because they broke their leg. And I'm just giving an example.
Oh.
Yeah, you know, rehabilitation.
Rehabilitation, got it.
I'm just giving an example.
Oh, okay. Know? So it could be from rehabilitation, mental illness, and then just medical reasons.
Yeah, like I'm just like giving an example, you know.
Okay.
And then also like my other experience too, like I used to work at the CNA. So, you know, for 7 years. I did that for 7 years. So Yeah.
If anybody wanted to follow your journey, how would they do that? So what is your social media?
Honestly, on my social media, y'all can't follow me. But I mean, no. I mean, yeah, like, I mean, if, you know what, if...
Because you're a beautiful woman. I mean, somebody might be, wanting to put you on an ad or something.
You know what, honestly, if anyone does want any resources, I mean, they have, like,
Oh, you give out resources.
I mean, no, like, just, you can look at those, like, nurse, I would say nurse, is it? I can't really think of it now, but I mean, just, follow any of those.
You know what? I'm going to get the information and I'm going to put it on my YouTube channel, and it's going to be in the description box.
Yeah, I mean, but
so they can find those resources. It'll be in my description box because you have my information. And we can talk about that later. And thank you for listening to the Chanel Talks podcast with
Courtney Gigi.
Courtney Gigi.
Thank you.
You heard it here first on Chanel Talks podcast.
Thank you.
Bye.
Bye.